Today's episode is called Flesh and Fantasy, and our guest today is Dr. Chelbi. Hi, Dr. Chelbi.
Hello.
Thank you for coming. I must say we love you so much, we both do, because you are such a genuine and natural
Yes.
plastic surgeon.
Yes, non-commercial.
Not commercial at all, and who
Absolutely.
is not afraid to tell a patient no.
Yes, which is not very common, by the way, in this
No.
industry. It's an honor to have you.
Thank you.
But first of all, I would like to know what inspired you to get into this domain,
Yeah.
plastic surgery.
This is I would say by coincidence a little bit, but we are, when we receive our training, we choose to be first to be a surgeon, first to be a doctor and after to be a surgeon because we love what we do with our hands. And after came the plastic surgery, not because of the aesthetic part. In the beginning, if it was really about the reconstructive part, because we used to treat a lot of burns, accident, to repair cancers and everything. And this is what we start to do. And this is where we really we retrain and we know our job. And after, it's really a refinement to go to aesthetic, but because it's very difficult to go on a person sometimes who are really nice and make her look nicer.
Yes.
So in the beginning it was for reconstructive and plastic surgery, and after, of course, when we go to private practice, we go more for the aesthetic part, and there's like an artistic part there that we
Yes.
really love. There's a part where we use our hands,
Yes.
and I love it.
Oh.
But we tend to forget that. There is
Yeah.
another part why you
Yeah.
start with this. Yeah, exactly.
Like,
Mm.
but what are the most inspiring aspects of your job?
The most inspiring aspect, I think, it's this part of plastic surgery and reconstructive surgery. Really, we feel that we can change people's life. Aesthetic part also can do this, and people are really grateful. And this we find it in our job as doctor, our plastic surgeon, our surgeon, and this is really rewarding.
Like the happiness you give the patient.
Yes, when a patient came back and you see that when she enters for a follow-up, the first thing that I check if she's smiling or not.
Yeah.
Yes, and this is very important for us.
I mean, I know we're always smiling when we come to you.
I am always smiling, always asking for things. But what I love about you, doctor, is, women are always insecure about something, and we always want more. And, now with everything going on, I want a little bit of this, I need this. You make sure to say, what for? What are you doing? Why are you doing this? Or why? Especially her. Can I blame it on her?
I mean, I know me and Dr. Chelbi fight all the time.
Like, I sometimes I look at her and I hear her, Carol, no, I am not gonna do your cheeks. But when is it enough?
It's when it's enough, when you know that you will not make this person look better.
Yes.
If she looks already nice, and it's we're not seeking for perfection. Women sometimes they seek for this, but perfection sometimes can be a problem.
Thank you.
Yes.
That's
Thank
true.
you.
I have to admit, I'm very guilty in this aspect. Like, I bring Dr. Chelbi pictures of like celebrities, or I want my cheeks to look like this, or I want my jawline like this, or my lips are uneven, and you're right. Like, everything doesn't have to be perfect, and I think that comes from a place of like insecurities,
Yeah.
and I think we need to work on that instead of.
I know, but it's nice to enhance beauty. It's always
Yeah.
room for enhancement. But like changing completely and becoming, I feel like all these girls on social media are looking more and more alike.
Yeah.
Everyone
So-
looks the same.
So,
Yeah.
like Carol said, when she comes with a picture and she wants to look this way, how do you deal with that?
If you can do it, why not? Sometimes it's like an inspiration. If someone come and make you like show you how what she wants, when she likes, it's good. After the problem or let's say what is important, to explain to her what can be done and what cannot be done, because we cannot transform someone in someone else. This is not possible, and this is not nice.
It's not
And
nice.
everyone has to be nice as he is. You know, if you have someone, if he's born with no cheeks, with no chin, we can even go for surgery for that, and they will look better. We do even surgery on the bone. We can transform a face if we need to do it. But if we see that the person, she looks nice, but just because the trend is that we have to have like a wide jawline and everything, no, we have to explain, and we have to reassure, and we have to let this person know that she looks nice, because sometimes they don't even know it. And we spend sometimes more energy to convince them not to do things than other things.
I know.
It's more difficult.
But I respect you for that. I respect you for that, because I feel like everybody being not perfect is also beautiful.
Yeah, of course.
It doesn't mean that you should not take care of yourself. Like, no, it's important. Your face, it's your frame. But enough is enough sometimes.
Yeah,
like,
I
for example,
agree.
she was telling me that she had insecurity about her nose.
Yes,
Yeah.
I mean, my nose was something that I really struggled with for 10 years. But then, first of all, my parents wouldn't let me do it. But the second reason why I struggled with it so much is that I hated it on camera. Live, not so much, I was fine.
Yeah.
But on camera, I hated it. And then my other fear was looking like everyone else. I didn't want to become this plastic-looking girl, but still it bothered me. So I would wake up one day with a decision like, no, khalas, I want to do it. And then the next day be like, no, but I still want to be me.
Yeah.
And in the end, I'm happy I did it. It changed me a lot, which was something people struggled with when they saw me. But for me now, I can't look at my pictures before.
Yeah. This is true, especially for the nose, especially if there's a problem with the nose. You know, it's one of the surgery what we do it at an early age sometimes, because people, they will get used to this new nose, and it will be them. If you do the nose at like more advanced age, it's more difficult, because you look at yourself, maybe you will not recognize yourself. But what is important, and you said it's really to think about it. When person come for nose, for example, nose job, if there's not too much problem, or even if the nose is big, the first question that I ask is, since when are you're thinking about this? And if they say since like 1 week, no, take your time and think about it. And usually people, they would say that, yes, I'm struggling with this, I'm thinking about it since a long time, I couldn't do it. And you know that these people are prepared for this. Otherwise, you have to give them the time to think about it, to be sure of that, what they want. And in this case, it's important to see and to show pictures, to know exactly what people do. I remember one patient came from Istanbul, which is like, we can say, like the capital of the rhinoplasty stuff. And she was living there, and she came to see me. I told her, why did you come here? And she told me, I don't want this nose that everyone has with a small elevated nose, even if it looks nice on someone. But she wanted something natural. She did not want anyone to know that she got a nose job, and she knows what she wants. And in this case, we can have a good result and a happy patient.
Yeah. And it's a beauty enhancement.
It is a beauty. It is always beauty enhancement, but when it becomes extreme, we have to think about it. And insecurity, sometimes it can be justified. Maybe if there's a nose, if there's something wrong with insecurity, it's fine. We're here to help people. But sometimes insecurity comes from other things. Some other people, they were like making some remarks on the appearance. It can be a problem with the partner, with the husband. It can be beyond this, and we have to talk with people. And sometimes we feel that it's not really this what they want. They have other problem that they have to solve before. We don't have the solution of everything, of course. Insecurity, it's sometimes there's a reason for the insecurity, sometimes not.
I think there's always some hidden reason for insecurities. Like you must have heard something from someone, and then it grows and grows with you.
Yeah, absolutely.
Over time.
But do you think that social media is a big part of this also?
100%.
Yes.
People, they identify themselves as their pictures are on Instagram, using filters and everything. When they look at themselves in the mirror, they don't recognize them. I look like the picture that I post on my profile picture. This is how I am. and they have like an entire like second life on social media.
Yeah.
This virtual life when they know them only on this, and
Yes.
and this is a problem because it's like virtual life. It's not reality.
Unrealistic.
It's
also.
unrealistic, and sometimes they come and they want to look like the
filter.
filter. And if we can do it, as I say, it's fine. Why not? In the other hand, it's comparison because people they compare themselves to
Yes.
others on social media,
Yes,
and they
yes.
forget that they this not even Photoshop now. It's just like filters
Yes,
on
true.
videos, and people they don't really look like this, and the standards of beauty change.
That's what
Yes,
I think
exact.
our beauty standards have become so high
Yeah,
that you can't even compare to the expectations. I mean,
yeah, exactly.
it's really hard. I mean, I face it myself. Like
No, I think we're all victim for it.
Yeah.
I mean,
Everyone.
And it would be a lie if we don't admit it. But I mean, there has to be something has to stop. I mean, for the younger generation, I mean, we are setting now like very high expectation for teenagers, for all these girls and men. It's not only girls.
Yeah.
it's
oh, I
also men.
definitely think
It's
men
a lot.
are
It's-
affected too.
So many feel the pressure, and so many feel the pressure to start these plastic surgery at a very young
Yeah.
age.
Yeah.
So yeah, I have that
I think the
experience.
thing that I think we cannot stop it, but we have to be aware of it, and we have to even to educate these young people that this is not reality, and maybe even they know better than us because
Yes.
they are raised with this. For us, it came like this one of the
Yes.
sudden we can use it, so it's more for younger people. I think it's easier, but what is important is to be aware of this and to build this self-confidence.
Yes.
So yes, if we can do things to enhance ourselves, yes, why not? If this social media make men or women looking more closer on how they eat, to be fit and everything, to do more sports, it's good.
Yes, it's
But
a
we have to,
lifestyle, it's-
but it doesn't have to be extreme.
No.
Yeah.
Like everything.
How do you deal with patients that come to you with body dysmorphia?
Yeah, this is very difficult, and one of the problem with body dysmorphia is the lips. It's really some people they come to me to see me and they say I want to put some stuff in my lip and the lips are like this. I tell them it's like if we are not. We don't look at the same picture. If everyone has an image in his of his body. It can be also on the body and everything, and we have to take the time. You have to discuss, and we have to explain things. And if needed, we have to refer these people to see a therapist or something because there's really a problem. Yeah, sometimes it's a real problem. Body dysmorphia is
It's
really,
true. I know,
it's really
like,
a problem,
I've heard Megan Fox has it. And for me, she's like an idol. Like, she looks
Yeah.
perfect. But she doesn't see that.
It's
And I think it is a really big problem. But,
Yeah.
like, you can't, it's really hard to convince the person of
Yeah.
what they look like.
It takes time.
I mean, for example, but I don't think I have it. I think I have more of insecurities. Like, I hate my stomach, for example. It's a
Yeah.
huge insecurity of mine. And look, she's shaking her head. I mean, she doesn't see it.
She doesn't have anything.
But I
It's
think-
so beautiful. Like, I don't understand.
I mean, but for me, after giving birth, this has become my
this was
insecurity.
16 years ago you
Yeah.
gave.
And I've been nagging for 16
Oh my
years.
God. Like, 16 years ago. It's actually. Okay, yeah, but.
I mean, I don't think this is not considered like body dysmorphia.
It's not body dysmorphia because first you are aware of this and it's good that you talk about it. You say, yes, I have something in my stomach, I'm not secured of this. Maybe also because you used to be very flat, very athletic and everything, and once we give birth, we don't stay the same. Yeah. Some people maybe yes, but most of the people, they will have what we call muscle diastasis. The muscle will be separated a little bit. Even if you do a lot of sports, you cannot be flat.
See, that's what I have.
Sometimes you can, with age and hormones, you can have some fat and everything. But also the problem becomes a problem when you have just a little bit loose skin. You're not like before, but you forget that you are at this age and this is even better than the, let's say, the average. And most of the average, and some people they really want to come back to their 20s body. Sometimes it's possible, but the skin and everything, sometimes it's not, and we have to live with it, and we have to be grateful. We have to see also what that we're maybe better than many others.
Yeah.
Yeah.
I'll work on that.
This is what is funny. So everything, our problem are not like sometimes, and not sometimes, even very often I receive like people like they come together, two friends, two cousins, two sisters, and the problem that one of them start to talk about her abdomen and the other one, no, you don't have anything, you're flat, you're great. And the second one will talk about the nose, and the other will, no, your nose is fine, it's perfect. So everyone, it's like, this is with women, it's
This is us.
what works for me doesn't work for you.
Yeah.
Doctor will be like, enough, you two, just let her. She needs to do this.
Yeah.
No, you need a professional to guide you with
Exactly.
this, for sure.
That's why we are here.
Yes, I agree. But like, I say this because I hear this 24/7. This is how we start our day and end our day. It's a lot of, this one is higher than the other, this one is showing like this, I am not, and she would say I'm not flat, but she would eat anything. So I would be like, what do you expect? Yes, we are not the same age as we were before, but it doesn't mean I can eat whatever I want and look this way. And she does look good for being able to eat what she does.
Yeah.
Don't let me say all the...
Thing is, I think I'm my worst critic.
Yes.
So, and also I have this eye where I see things that maybe other people don't see. So I'm very like, but I'm working on it. You don't like, it doesn't have to be perfect.
Because we have two different approach when it comes to adding things. I mean, yes, we all have insecurities, but she wants it to show. So she's in a procedure. If I went and I did something to my face, if it doesn't show, even though she's glowing, for me,
We fight about this all the
yes,
time.
this is why I respect them, and I'm more for the the natural beauty. If I want to, of course, I want it all, but like, no, if it cannot show and you can enhance it in that way and not be like, oh, did you do your eyebrows? Did you do your cheeks? This is also kind of, no, I don't want to be perceived that way.
No, and we love you, doctor, for
Yes,
this.
but she
I
would
mean,
come and be like, it doesn't show. Where does it show? Where? Can you see? Can you see? I went to the doctor. I'm like, yes, you are glowing. So this is what I mean. This is.
Yeah.
I do admit, sorry, doctor, I do admit I have
She is
overdone it
beautiful.
in the
Like,
past.
It starts within as well.
Yeah, but I am with the more natural look
Thank
now.
God. Thank God.
Yes, but this is about personality and
Yes.
everything. So you are friends, but you're different. So, and that's why sometimes you see it not only about what you're doing as plastic surgery or injection and everything. You will see it on how the way you dress. You see the way you put makeup and
Yes,
everything,
absolutely.
and
Absolutely.
it goes together. But what is the limit? It's to look nice at the end and to not look weird and odd.
Yes.
So this is
yes.
really the limit, because your hair, you can change the color, you can make
Yes.
how you dress, you can change it, but what you do to your face, it should not be
Absolutely.
driven by like trend or by what you really think about it in the morning. It should be
100%.
that's the thing. So sometimes you
Yeah.
don't feel good, you want to do something, and when you do something you want it to show. It doesn't mean that you will want this the next week and the next month. And that's why you have
True.
to think about and to think that it's not okay. It's especially injections, it's easy, but it's not like putting and removing knot. You have to, this is your face, and
Yeah.
you have to respect it.
And how do you deal with trends? Because we're seeing that it comes trends in how a face should look, or the lips the certain way. So how do you deal with the constant change?
The problem with the big problem with the trends, that people, they think that if there's like this treatment is trendy, that we can do it for everyone. So nowadays people, they come, they don't say my face look tired, I look a little bit different because I age, I lost weight and I don't know what happened to my face. No, they come, I want this treatment. But you don't know if this treatment, which is trendy and which is on
actually
Instagram,
good for
it's
you.
for you or
Yes,
not.
yeah.
And if you start to just listen to the patient, you want this, okay, I will do it for you, it will be really not nice, because maybe it will look nice on certain people, but not on others. And you have to know that what is trendy today, we know it. It's trendy today because people talk about it. It's not because it's something new. It's there, we do it, but we do a lot of other things. And if we have different techniques, if we have different treatments, because what is really difficult is to choose the right treatment for the right person. And there is also this artistic part. There's a lot of taste in this. and you have to listen to people, not really just do what they ask for. You have to explain to them that this is not for them, and if they trust you because they know you and they come back and everything, you with the consultation with the years, sometimes we build like a relationship and we know exactly what these people want, and you have to explain to them, and they know also what is your taste, what you do, and this is how we can have a good result. And trends sometimes are nice, and sometimes are not. There was this trend of putting a lot of fillers on the jawline. All the people that come, this is now all the people that come back to remove and they end up like.
Don't look at me, I
like-
can see you.
No, it's.
I call it the alien face, but yes.
Yes, exactly.
Yes.
Yes.
And all the people look the same.
we
and it's
have
not
removed
nice.
that.
No, he knows. Oh my God.
No, I have to say, you do that perfectly, doctor.
Yes.
I mean, you're not.
I try.
No, you do that perfectly. You
And he
put
acknowledges.
patients back in their place.
No, he acknowledges. No, very good.
So, doctor, do you think AI and robots will play a bigger role in cosmetic procedures?
They are already, I think, playing a role because of all these filters, all these, some people, you look at some videos, you don't know if it's a real woman or not.
It's true.
And people, they start to compare themselves to these models. This is very important. And in the other hand, that we use it already. And we use it especially to simulate a little bit how will be the result of the surgery and how we'll predict this. So you use it especially for the breast, and it has really quite realistic results. So we can predict how will be the breast after the surgery. That can be just the augmentation or reduction and lifting, and we can discuss with the patient using these AI tools and the comparison to predict the results. So this is already here, and
I think it's
very
reassuring for a patient to see obviously it's AI, but to see what the end result will roughly look like.
Yes. What is difficult is it's how to predict how it will be. So in some domain it's quite accurate, in others it's more difficult because we with the AI, with the tools, it's just data, but for us it depends on the skin, it depends on a lot of things, how the results will be, especially on the face.
But also I've heard some procedures and operations are being done by robots now.
This
How
is
do you feel about that?
This is in surgery that's a field of robotic surgery. Maybe not in aesthetic surgery, more maybe in reconstructive and other kind of surgery, when the robots can do the job just for microsurgery and everything. Yeah.
I don't know how I feel about trusting a robot.
The machine, there's always someone behind the machine. It's not the machine. It's I think it's just to make some technical part more accurate. The robot will not shake.
Yeah.
Okay.
When it's very, very.
That's true. That's true. Okay. Doctor, I'm gonna show you a picture,
Yeah.
and I want your opinion. I'm showing you the Catwoman.
Yeah, this is a lot. This is how it's really extreme and how it's really badly done. And this picture, it's very old picture. We all know of it. And I saw a few months ago, I saw it in one of, I think it was a French TV show. What she was telling that she did not anything.
Wow.
If I remember, if I'm not wrong, but this is the extreme thing, and this is very bad for her, and it's very bad from who, as a surgeon, agreed to do this.
Yes.
And this is many things done, and I don't know. The surgeon, I think, should not listen to what we ask for.
I've heard that her husband was fascinated with wild cats.
Oh my God.
So she did everything to look like a wild cat, and
So it's an obsession.
I think she passed away recently.
Yes. So
Yeah.
it's an obsession.
This is not normal. This is, I think, this is not like aesthetics or anything. This, we can compare this to all these people who will remove fingers, they remove their ears, they put the I don't know, not even the piercing, and they will alter things for forever. You have some people, they amputate cut the nose to look
Oh,
like
wow.
aliens, to look like avatars. You have a lot of these, not a lot.
Like these extreme cases.
Like these are
Yes.
extreme cases. This is not. This is completely different. And these people, they went through a lot of things.
Oh my God.
There's a lot of examples, like this guy who, like, it's like Barbie, Ken and
Yes,
Barbie.
Oh
yes,
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 I've seen
yes.
those.
Yeah. This is really extreme.
Mm.
But then there are enhancements that are like this, and it was a big talk.
Yeah, exactly.
What's your...
This is very nice, and I think this is due to a lot of things and not only surgery, because this is first, I think it's really a completely different lifestyle. And what I see a lot of these pictures on internet, people, they show me a lot of these, and usually they compare her picture, the first picture, when she's at this maximum weight gain, when she was even, I think, maybe using some substances, I don't know.
Yes.
You know, even during the day you can have very bad
Yes,
day.
yes,
You
yes,
can
of
have, you can
course.
look like awful in the morning when you wake up puffy. So you compare this photo with the best of your pictures.
Yes.
This is the first thing. So I think that the first thing, it's really a totally different lifestyle. There's a lot of weight loss in between. There's a lot of skincare, and maybe I cannot be sure that there's some surgeries behind, but if it's done, it's really well done. And yes, with if we do things correctly, if we do things in a whole program, like with a different lifestyle, with the skincare, to maintain the skin,
So
to
it-
do small
yes.
stuff, we can have really drastic improvement to the best
'Cause
version of
we
us.
woke up one day, it was like everyone wants what Lindsay Lohan did.
Like
I
everybody-
want that
yes.
procedure. I want to look
Who
that
did
But
way.
this?
she didn't do a procedure, because she did, I think, a lot of the you know, before and after there's a lot of things that in between, and it's not in one day that you wake
Yeah,
up and
it's
you will
true.
do a
I
procedure.
think
and
that's
it's
what
like
people
this.
don't
Yes.
realize.
Of course, yeah.
And same goes out for Donatella, for her age, and we all
Yes.
know that Donatella Versace, she did a lot.
Yes,
But also it's she got a lot of media for her new appearance, and
Yeah.
it was a better appearance.
For sure, because she's on the she's on the media. She's in one of the most prestigious
Yes.
brand. Her face, and she's like an icon, let's say.
Yes.
But
course.
maybe some people I would not say abuse, but you know, this what the problem was with her. It's she got, I think, some permanent filler that used to be done like years and years ago.
Okay.
And this the problem that you can see the problems years after, because they don't go, they migrate, they do like granuloma. You can see on her lips how
Yes.
they used to be, the eyelid. Sometimes, you know, surgery can go wrong if you choose the wrong person, and unfortunately you can look not really nice. And I think that lately maybe she done stuff to improve this, and it works, because she looks better. I don't know her age, but
69, I think, or
Yeah, I think
yeah. I
it's-
mean, but she looks
so
good.
yes, she looks much better than before, and yes, I think yes.
But I remember the whole era of, because I know
The
a few
lips.
girls like with the permanent silicone
Yeah.
lips, and they suffered a lot because
Yeah.
it's really hard to remove apparently.
It's a big procedure, right? You need to.
It's not a big procedure, but the problem that with this permanent filler, because it changed with the time, it migrate, and it like extend the lips, and you cannot remove it, because the lips, you know, the lips, it's a muscle, so you have to inject the product. It's a little bit everywhere, so it's more about to remodeling of the lip. So it's a surgery that we can do under pure local anesthesia, just to remove part of the filler, to reduce the volume of the lips, and to enhance the appearance. Yes, it's doable, but yes, it's different from one product to another one. Some products are more easier to treat than others, but we can make things better. The problem with some people who had like infections and some, can be difficult. So, and that's why we have really to be aware of the product. I'm talking about this product are not used anymore since years and years.
Yeah.
Yes,
The products that we have now are really good product, and that's why we have to choose the right let's say clinic where
the
we
right
do this.
doctor.
And the right doctor.
The right doctor will really advise you not
Yeah.
try to take advantage of this, and he will use the right products. You know,
Absolutely.
there are a lot of products. People sometimes now, let's say you have a lot of this discount stuff and everything. I don't think that it's a good idea to do discounted treatment for the face.
Of course.
And even with the good product, you have to know really the experience. Teach us to know the product and to use the right product for the right person in the right area. A lot of people, they come today and they ask me, this about the trends. Now the trend is to say filler. No, I don't want filler, because it's a trend to say this. The only problem is not the filler. The problem is people, they abuse and they misuse the fillers.
Yes.
So if you use small amounts of the right filler with the right person, you will have a beautiful result, and no one will notice it, even if you not like it.
No, absolutely. No, she's
And
changing.
I think
We're working on it.
No, but yes, I absolutely agree. And I think too much fillers also, I'm not an expert, but it goes to
It
your
migrates.
face. Yes, so it
Becomes something called the pillow
Pillow
face.
face.
we've
the
heard.
pillow, what we call the pillow face and all this stuff, it's not when we use like 1 or 2 syringes of filler.
No, of
There,
course.
there was a trend like now, like the companies pushing to use more and more fillers, that everyone you come to the doctor will tell you, you need like 6, 8, I don't know how many syringes. This is which is not nice, and if you come back after 4 months, he will tell you, yes, you want more.
It's the commercial part.
It's, I would not say commercial part. Some doctor, maybe they do this and they think it's nice because for them it's nice. I don't know, but this extreme to reach this, it's extreme. If you use a lot, so many times you repeat it. You don't look to what was done before, maybe by others, and you keep doing this, and that's why it's not nice. But if you say no sometimes because you see that there's fillers, so there's no need why you do it if you know that it will not look nice.
Yes.
Yeah.
And if you do a lot, if the filler it's badly choose, it will attract water and what we call the pillow face, because it's over injected. It's not
Yes.
because it is injected. The second problem that people, they try to resolve all the problem with this. Not when we reach a certain point that we need a facelift, you go for a facelift.
Yes.
If you try to just to inject because you will lift, which is not true, you will
That's
end up like
yes,
this.
yes.
If you reach the stage of facelift, it's better to go for a surgery.
Yes.
Yeah.
And now people, they become more extreme because they don't want anything injected, they want facelift. So they will come. This is what you told me. You asked me about the trends. The trends now, it's ask for a facelift at a very early stage. What we can do sometimes, if it's a small thing, and we can do it, but we can do with a lot of other things some
Yes,
enhancement
it's
to
true.
maintain what you have. And when comes the time for the surgery, we go for the surgery.
I've heard girls are going for the ponytail lift and they're like in their 20s. So I find that a bit crazy. I mean, what I loved also about you, doctor, is like, okay, you know me with symmetry and my eyes. And I was like, doctor, my nose is a bit crooked. Like, I need to fill in this tiny. He's like, no, it's dangerous.
I hear him.
It's dangerous
I hear
to
him.
touch the nose. So, no, I'm not doing it.
For
I'm like,
this small
okay.
thing, why you take a risk? And
Yeah.
this is even for the surgery. The surgery is a surgery. Even if it's now we have the good techniques and it's safer, but the question is, does it worth the result that you will have? So if it's yes, we'll go for it. If it's too much for the small enhancement, no. That's it.
And we love that about you, doctor.
So let's to say it's a journey.
It is.
It's a journey and a step at a time, and you will get the end results.
Yeah.
Thank you, doctor, so much.
Thank you so much
Welcome.
for being with us.
We have an appointment with you very soon.
I need the touch up.
Thank you.
Welcome.